I asked 20 doctors to share their least favorite part about their job. I'll go first. Not knowing the cost of treatments and tests for my patients make it really difficult for me to be an effective doctor. I can have all the answers in the world, but if my patient can't access this test because it's ridiculously priced, which happens very often, then I'm not actually helping them, am I? But because of our complex hybrid healthcare system, I have no idea what the costs are for anything these days, and that's how most doctors feel.
My name is Dr. Anthony Youn, and I'm a board-certified plastic surgeon. My least favorite part about being a cosmetic plastic surgeon are the male companions of my female patients. I can't tell you how many times I have sat there and listened to a guy tell me what a woman should have done. Sometimes I honestly just want to slap them.
Get out.
When a guy tells me she needs liposuction, I really just want to turn to him and say, why don't I liposuction you?
Hi, I'm Dr. Benjamin Schmidt, also known as Doc Schmidt, and I'm a GI doctor, which means that I specialize in gastroenterology. In rare cases, the colonoscopy prep doesn't do a good enough job cleaning out a patient's colon, and there's sometimes even identifiable food in there, like corn. It's always corn. But then I have to use a tool, kind of like a micro power washer, to try to spray all that leftover gunk and poop off the walls of the colon and suck all of it out so I can actually see and try to look for polyps. It's super gross.
Hi, my name is Dr. Winters, aka The Dentist Online, and I'm an orthodontist. The least favorite part I have of my job is the fact that when you go home with braces, I can't control what you do with them. I can't control what you eat, I can't control if you brush, because a lot of people get these white nasty spots around their teeth, the decalcification or cavities, and I wish I could just go help them. And as much as I tell them, they just don't do what I want sometimes and end up with those white spots.
I'm Dr. Danielle Jones. Some of you may know me as MDJ, and I am an OBGYN. That means I take care of anything having to do with periods, pregnancy, and the female reproductive tract. Pregnancy and birth are expected to be, and honestly are, a very happy time in most people's lives. But when things are bad in this field, they are often heart-wrenchingly bad. I am always so honored to take care of patients experiencing loss, but at the same time, that is a really difficult part of my job.
The least favorite part of my job is unfortunately something that I have to do relatively frequently. It's break bad news to patients, often giving them a cancer diagnosis for the first time or telling someone's relatives that a patient has passed away. But the way you break that news is important. You can provide the patient with some hope, optimism, some safety, confidence, security, and just give them some dignity and respect and make them feel comfortable, often at their lowest point.
Hi, I'm Dr. Siobhan Deshauer, also known as Violin MD. I'm an internal medicine and rheumatology specialist. I'd have to say the 24-hour call shift. I mean, I love the excitement and the camaraderie in the middle of the night, but I know how tough the lack of sleep and stress is on the body, and I hate feeling like I'm having a negative impact on my own health.
The least favorite part of my job is dealing with insurance companies and paperwork.
All the BS, paperwork, and administrative tasks I have to do.
Dealing with insurance companies.
Gosh, insurance companies really give doctors a runaround.
I got into this profession to actually hang out with people, as opposed to focus on medical documentation, which is absolutely important.
So that includes insurance pre-authorizations, calling around to a bunch of pharmacies, coordinating really complicated outpatient care.
The insurance denies their surgery because they haven't done 6 weeks of physical therapy.
The list goes on. It is so frustrating.
I hate having to deal with insurance. Yeah, that's it.
Hello, my name is Ed Hope. I'm a doctor working in the emergency department over in the UK. Most people looking into medicine would probably say dealing with things like bodily fluids, but you kind of get used to that. The hardest thing for me at the moment is working in the NHS. Although the NHS is much loved by people in the UK, it's a failing system through years of mismanagement and underfunding by the government, meaning we can just about provide safe care, but certainly not close to the care you want to provide or the care that patients deserve.
My name is Ricky Brown, and I am a board-certified plastic surgeon in Scottsdale, Arizona. My least favorite part of my profession is that everyone expects that I drive a Ferrari, and I just want to drive my Toyota Tundra. Can't a guy just drive his truck and not be expected to drive some Rolls Royce or Ferrari?
Hi, I'm Dr. Rena, Malik, urologist and pelvic surgeon, and a urologist is essentially a surgical and medical doctor of the genitourinary tract. The least favorite part of my job is how little time we get with patients, particularly patients who come to me with issues about sexual health or intimate problems. They need time to be comfortable talking about what's wrong with them and also to build a secure and trustworthy relationship.
What's up, everyone? My name is Jake Goodman, and I'm a psychiatry resident doctor in my 3rd year of residency training. The least favorite part of my job is that mental health stigma can prevent people from ever seeing a psychiatrist in the first place. Although it's gotten a lot better, there's still a ton of misinformation and fear about medication and therapy for mental health. That's why I'm on social media, to fight stigma and educate people about mental health disorders and treatment options, and to let people know that reaching out for help is one of the strongest things that you can do.
What up, my name is Dr. John Patton, Doc JP3, and I'm a board-certified anesthesiologist and a regional anesthesia and acute pain medicine specialist. What is my least favorite part of my job as an anesthesiologist? Many people still have no idea what we do. Hi, I'm Dr. Patton. I'll be your anesthesiologist today. Hi, Dr. Patton. Are you gonna give me the Michael Jackson drug today? As anesthesiologists, our primary job is to keep you safe. We can be found all over the hospital, from the OR to ICU, surgery centers, labor and delivery. There's a saying that goes, keep calm and call anesthesia.
There are bad parts of being a doctor, but there's also bad doctors. Click here to see my video about doctors behaving badly, and as always, stay happy and healthy.